today's show is going to be very unique. Okay? So kama mnavyojua, every Wednesday ni siku ambayo tunawaletea mambo ya afya. And every Wednesday now officially itakuwa ni Afya Clinic, where you come, tunaongelea mambo ya afya yako, because it's very important. If you're not healthy, you'll not be able to go to work. You'll not be able to go to church and pray. So your health is number one. Okay, and your health consists of how you eat, how you exercise, generally your lifestyle. So every Wednesday tutakuwa hapa na daktari, and we will be talking about matters your health. So if you have any question ambayo ungetaka tukue tukiongelea, ama you have any topic that you'd want us to tackle, tell us, tutakuwa tunafanya hivyo. Sawa sawa? So this is MBCI TV, ambapo tunabadilisha maisha by the grace of God. Very happy and blessed to be here once again. And of course, as I've said before, every Wednesday itakuanga ni siku ya Afya Clinic. Sawa sawa? Afya Clinic ndani ya Rausha, where we have a doctor ambaye anatuongelesha, anatuambia about ile ugonjwa yenye utataka tuongelee. Whatever you want us to tackle, that is what we will be doing. But for today, tutakuwa tunaangalia ENT. Na ENT ni nini? ENT ni ear, throat. Yes, ENT, ear, nose and throat, in that order. Ear, nose and throat. So ni daktari ambaye anatackle hiyo mambo yote. So if you have any issue with your throat, with your nose, with your ear, today tutakuwa tunaiangalia. And I'm also very interested to know, hizo tatu ziko connected aje? Why do we have the same doctor ambaye anafanya hizo zote pamoja? So today, that doctor ndiye atakuwa akifanya hiyo maneno. And of course, we are live on Facebook on MBCI TV, and we're live on YouTube on MBCI TV official YouTube page. On the comment section, tutakuwa tukipata ujumbe wako, and then of course we'll be looking into it. But kama uko majuu, all right, and you want to get us through our website, pia it's very possible. That is www.mbcimedia.co.ke. Ukiingia pale, watu wa abroad nini ama you traveling and you want to find us through our website, pale you'll be getting all the details, and you'll find us live there as well. And we are also watu wenye wanatuwatch pale kwa TV, Go TV, Star Times, Suzuki, Signet, free to air. Ambie kila mtu, because you want all of us to get blessed by what we are doing today. Now, as I said before, today's show will be a bit different. Sawa sawa. Now, hatutakuwa tukianza na the daily updates vile tumezoea sote, because today ni specifically siku ya health. All right, so we will be starting with an amazing segment about the healthy living. And then the healthy living, you'll be knowing what exactly you're supposed to do to live healthy, especially now today that we are talking about ENT. So ni nini unatakana kufanya so that you will be healthy generally. And then after that, our guest will be joining us as we talk about the ENT. So any question that you have, we'll be getting to look at it. And in that as well, tutakuwa tunaangalia zile myths zenye zinakuanga about ENT. Watu wakisema ati ukinose bleed sana most of the time, wewe lazima uko na high blood pressure, ende ukaangaliwe. Yeah, so you have so many myths ambazo zikuwa in this topic of ENT. So we'll be looking into that, and also to hear from a couple of people that we interviewed na wakatuambia what they believe about ENT. Okay, so kama umewahi kuwa treated na ule daktari akakufanyia mambo yake, this is where you talk about it. Sawa sawa, because you will know what they did right or what they did wrong. This is the place to be. Tuneka kila kitu black and white. Hakuna gray area, black and white. So any question that you have, tutakuwa tukijibu pale. And then we'll be taking a very short break. Tukirudi, we'll be coming back with our guest, and also just to know about the pointers ni nini amesema, and to make sure that you have gotten each and everything. But of course, today pia lazima tukue na the tips za health, because of course, you need to stay healthy. All right, now without much ado, or without further ado, yeah, let's get into the healthy living. Tuone today, what are we getting from the treatments ya ears? What are you supposed to do so that you stay healthy? All right, tuingie ndani ya the healthy living.
Welcome to Healthy Living. Today we are going to discuss how to take care of your ear health. Number 1, avoid inserting foreign objects. Using objects like cotton swabs or hairpins to clean the ears can damage the ear canal or eardrum. It's best to let earwax naturally work its way out or consult a doctor for safe removal. Number 2, don't listen to loud music. Listening to music at high volumes, especially through earphones or headphones, can lead to hearing damage or loss over time. Keep the volume at a moderate level and take breaks. Number 3, wash your ears regularly. Gently wash the outer ear with water and soap to keep it clean. Avoid inserting water deep into the ear canal, as this can cause infections or wax buildup. Number 4, keep your ears dry. Moisture trapped in the ear canal can lead to bacterial or fungal infections. Dry your ears carefully after swimming or bathing and consider using earplugs in the water. Number 5, get regular checkups. Routine hearing checks can catch potential issues early. If you notice pain, ringing, or changes in hearing, see a healthcare professional to address the problems before they worsen.
Yeah, and you're back. I know that you've seen what you're supposed to do for your ears to stay healthy. As I've said before, today we're talking about ENT, that is ears, nose, and throat. Yeah, so if you have any problem with any of that, leo Dr. Oywer atakuwa anatuambia what are you supposed to do or what are you doing wrong. But before we get there, tuko na watu wamesema mambo yao huku nje, because I know that sisi wote tumekuwa na either an issue with the throat, labda ni throat infection, umekuwa na an issue with your ears. There is one of producers huko alisema ears zake zilikuwa na shida sana na daktari walimfanyia maneno huko nje. Yeah, so najua that all of us hapa na pale, we've had an issue that concerns an ENT specialist. Now, let us take a look on what are some of the myths zenye ziko around the ENT. Okay? Ni vitu gani hizo ndio watu huongelea sana about ENT? Na sisi wote tunajua ni myths, na kama haujui ni myths, today you know that it is a myth. That nasal bleeding ama nose bleeding can be stopped by tilting your neck backwards. Ni wangapi wetu kikuwa na nose bleeding unekanga hivi kichwa nyuma alafu najiambia nitawacha ku nose bleed, nitawacha ku nose bleed. That is a myth. It is a myth. Sometimes you think it's true, lakini hapana, it is a myth. Na daktari najua atakuwa kiongelea because he will be joining us in a very short while, so we'll be looking at it. Why is it a myth and what are you supposed to do when you're nose bleeding? Yeah? And that whispering is safe when you have a sore throat. Ukiwa na sore throat, unatakana kuwhisper, usiongee na nguvu kwa hata sasa nasikia kana natakana kuwhisper hivi tu. So, is it true? Does it help? Ati ukishout kama uko na sore throat, una worsen the situation. So, we'll be looking at it and doc will be telling us ni nini hizi ndo zina cause sore throat. Yeah? And what are you supposed to do ukiwa na sore throat? All right? And then the other myth is hearing loss is always as a result of aging. Eti watu wakizeeka tu ndo wanakuanga na hearing loss. By the way, do you know that unaweza ukawa na hearing loss hata ukiwa aged 20? Yep. You're 20 years, naona mnaangalia mnacheka. It's true. Unaweza kuwa 20 years and you can't even hear well. Uko na hearing loss at 20. Yeah? So, the fact enye watu usema that ukizeeka tu ndo unakuwa na hearing loss, that's a myth. So as doc will be coming in, we'll be also getting to know what are some of the causes of hearing loss. At a very young age, unakuta someone is just 15 na haizi kusikia vizuri ama haizi kusikia na sikio moja, and you'd wonder what is the reason for that. Now we'll be taking a look at that. So those are some of the myths. You'll be telling us as well ni myths gani zingine mumesikia, because you have so many myths that are surrounding the ENT. So kama kuna myth and you umesikia, ama there's a fact that you know and you think it's a myth, please always tell us. We'll be getting to read your feedback and doc will be telling us if it's actually true or it is a myth. So as I've told you, our numbers are very open, 0721105105 on WhatsApp, 23814, our SMS code, which is absolutely free. And of course, we're live on Facebook on MBCI TV Facebook page, and we're live on YouTube on MBCI TV official YouTube page. All right? Na kwa hizo zote, tumia #Raushwa. #Raushwa on all that, and then we'll be getting to read your feedback. For now, let's get to take a look at what some of the people think about the ENT.
Sikuzaliwa kama sisikii. Hata ingawaji masikio moja nasikia, ingine isikii. Infection hii ilikuja through niligonjeka meningitis. Na hii meningitis nilipotibiwa, zile dawa nilitumia zilikuwa ni mingi sana na ndio zikaniletea hiyo effect. The last time nilipopona meningitis walinitoa maji kwa mgongo na the second day masikio yangu ikapotea yote. So I've been suffering for almost 2 years and after the kupona meningitis nilikaa 6 months nikitumia madawa za meningitis whereby hizo dawa ndio zililete effect yote ya masikio. So for now masikio moja inasikia, hiyo ingine haisikii. Nimejaribu matibabu kama kwa Afya, wananiambia hakuna vile itaweza fanya, itakuja sikia yenyewe. Lakini ningepata mtu wa kunisaidia ifunguke moja, iache kuguruma, niweze kusikia, ingekuwa ni msaada kwangu.
Nilikonjeka masikio. Sikio moja tu. Unajua ilikuwa inakaa kama mtu mwenye amekupika kofi kwa masikio. Sasa ilikuwa inaleta kama kelele, kama mtu mwenye inaguruma kama gari. Ilibidi tu nitafute sasa dawa ya nini kikwetu. Unajua masikio kiume wanachukua mafuta ya kuku. Nikaweka kwa masikio nikalala nayo. Sikulala na hiyo nini, asubuhi nikaona kama yenyewe, nikatoa hiyo nini mafuta ya kuku na masikio yakakuwa sawa.
Huwa mnaamini mtu akigonjeka masikio ni nini imesababisha huo ugonjwa?
Si labda tu ni ukitoa kimila yetu, kama mtu anakonjea na masikio labda kuwa umechokora ama ni vile tu ugonjwa wa kawaida vile sasa inakuja.
Na wakati nilikuja experience hiyo shida na haikuwa sikio, mimi experience shida ya koo. Hadi time nilikuwa form 1 nilienda nikakatwa, kuna kitu inaitwa kilimu. So nilienda nikakatwa na nikakuja nikaendelea na shughuli zangu za kawaida, nikasoma nikamaliza hadi shule. But hivi juzi mwezi wa 9 tu mwanzo nilikuja nikakuwa na shida ya koo. Nilikuwa na kohoa, nasikia uchungu. Hata nikimeza chakula bado nasikia uchungu, but sikujua nini ilikuwa inaendelea. But after some time ilikuja tu ikaisha yenyewe. Sikuenda hosi na sikufanyiwa matibabu yoyote. Kulingana na mimi mwenyewe na kabila yenye mimi natoka ama koo yenye mimi natoka, bado hatujapata any myth or misconception about kugonjeka sikio ama kugonjeka koo. Hiyo mimi naona tu ni kama magonjwa ya kawaida.
Nikiwa nimegonjeka nilipakwa mafuta ya kuku. Hii mafuta hii kuku ikishachinja unapaka mafuta kwa masikio. Ukiwa na shida ya masikio.
Ati nasikia ni nani wanaweka mafuta ya kuku kwa masikio? You guys. But we've said that is why we are here, because we need to know what are some of the very bad practices that we are doing ambazo ndo zinaharibu masikio zetu, and also what are some of the things that you're supposed to do and you are not doing them. That is why we are here today, and our guest is already here with us so that you can get to tackle some of the questions. Also, as we've said before, please feel free to send in your questions through our numbers, as I had told you before, and we'll be getting to tackle them vizuri. Now that I'm not alone and we're here with Doc, he'll be able to do all that. Now, today we are having Dr. Austin Oyuer from PGH Nakuru, level 5, yes. And he'll be doing all that. Any question that you have, through our numbers, ukiziuliza, we'll be able to get into it. So without further ado, let's get into the Afya Clinic. Hizo swali zote zenye mko nazo, today we get to answer them. Karibu sana.
Asante sana.
How are you?
I'm good. I'm good. How are you?
I'm good.
I'm well. Been good. Been better. Bit of a cold, but I think we're doing well now.
Yeah. In fact that you're a doc. Is it that kuna outbreak ya flu or what's happening? Because where?
I know, kumekuwa na hii story ya homa kali. Yeah, inakuwa affect like 2-3 weeks you're just being disturbed by this cold. But it depends on seasons. There are different viruses that cause different types of flus, and the strains of viruses are so many. Isolating one to find out which one is causing the problem is actually a big task.
Tricky, yeah.
Yeah, so we just treat them as they come.
But tuko safe?
Tuko sawa, tuko sawa.
All right, perfect. Okay, karibu sana.
Asante sana.
We're very happy to have you.
Glad to be here.
After a very long time.
Yeah.
Almost 1 year.
I've not been here this year.
Imagine you haven't been here this year.
Yeah, it's been a long time.
Very long, very long. So please say hi to people and then you can get into the discussion.
Good morning, everyone. My name is Dr. Oyuer Austin. I'm an ENT surgeon at Nakuru PGH, and today I'm here to sort you out.
Exactly.
Yeah.
Now let's just start with what exactly is ENT in layman's language?
ENT means ear, nose, and throat. But part of our qualification, we also add on head and neck surgery. So you find any patient who has a mass, like in front of the ear, we have the parotid gland. In the neck, we have the thyroid gland. Sometimes we have neck masses also. So we also deal with those. So it's ear, nose, and throat, head and neck surgery.
Okay.
Yeah.
How is that related? Because talking about the ear, the nose, and then the throat, like ziko places different.
Actually, there's something called the United Airway Theory. So you find the nose leads into the back of the mouth, and the back of the nose connects to the middle ear cavity through something called the eustachian tube.
Okay.
Down that helps maintain balance. Sometimes you feel like your ears are blocked. Then when you yawn, you feel like a popping sound. Then your ears open up again. So that one is related to that. And then you also find some diseases might start from the area of the throat, then affect your ears, can start in your ears, affect some other areas of your body also.
Okay.
Yeah.
You know, you said something very intriguing, that you can have like a sore throat and then it affects your ears.
Yeah.
It's actually possible. No, I've never
Quite
heard
possible.
of that.
We find some of the commonest ENT infections are acute otitis media. So you find someone had an upper respiratory tract infection, a homa, like you would say it.
Yeah.
Then it goes up that eustachian tube that we were talking about, then goes and infects the cavity of the middle ear. Then now you have bacteria colonizing the area, inflammation, pus is being produced, and before you know it, pus is coming from your ear.
From the ear.
Yeah.
Oh, okay. Now, what are some of the most common conditions that you've encountered as an ENT specialist?
I think since I came to Nakuru, the commonest we've seen is adenoid and tonsillar hypertrophy, especially in children. Ear infections are very common.
Okay.
Neck masses, yes, we've seen quite a few. Some patients will have masses, probably they were born with them. Some develop them later. We are also seeing an upsurge in cancers, especially of the nasopharyngeal area.
Okay.
That's the back of the nose. And also cancers in the larynx, especially for guys who are smoking, taking a lot of alcohol.
Yep.
So they're having lots of those. And also cancer of the esophagus and the hypopharynx, which is the area where the food passes through as we're swallowing it. So we're also seeing an upsurge of such also.
Okay.
Yeah.
And I know you haven't mentioned it, but the other time you're here, you told us that you mostly deal with kids, an ENT specialist, but you really mostly deal with kids.
Yeah.
So why kids? Is it that these cases are mostly found, like kids are prone to them?
You'll find for like the ear infections, kids are affected mostly because of now improperly treated ear infections. So like we talked about, the infection starts as an upper respiratory tract infection, goes up the eustachian tube, goes to affect the middle ear cavity.
Yeah.
Then as people do it, wanaeka mafuta ya kuku, wengine I've had people put in mafuta ya bunduki. I don't know where they get it from. Probably they'll tell us, but I've had patients saying that. And then probably someone gets to hospital, but they are treated with antibiotics for 5 days. But ideally they're supposed to be treated for 10 days.
Oh,
so you find the inadequate treatment now just causes the infection to come back stronger. It's sometimes more resistant to the antibiotics, which ends up causing a really severe infection. Okay. Some end up losing their hearing. Some develop like really serious complications like meningitis, abscesses, like they have swellings behind the ear, in front of the ear, in the neck, and the legs. So kids actually form like 90% of the patients that we see in the clinic.
Yeah.
Adults are usually like 20% probably, but then their conditions are more head and neck conditions, and some slightly have nasal conditions and ear conditions, but kids are the most because of them. Adenoids and tonsils, it's quite common in our setup. Yeah.
And what causes head and neck conditions, or rather sickness, for umesema sasa hii ni adults sana sana. So what mostly causes that?
Usually you'll find probably As they are growing up, probably there was something in that they were born with, but it's continued growing as they got older. So they never noticed it, and then it became visible while they were adults. Then, of course, also adult behavior, smoking, alcohol intake, and the likes have caused an upsurge of cancers also. Then, of course, there are those genetic conditions, because your parents had them, then you might also suffer from them. Exposure to radiation. You've had so many x-rays done, CT scans are being done all the time, so that can trigger cancer to develop in your body. Yeah, most of the time those ones.
Okay.
Yeah.
And it's very unfortunate that we have the genetic ones, zenye huwezi potelea.
Yes.
So what are some of these genetic conditions?
Genetic ones, basically we call them the congenital conditions. So you find probably you are born, your family, someone has a history of like hearing loss, so you're likely to suffer from hearing loss. Someone had history of like a head and neck cancer, probably hypopharyngeal cancer, laryngeal cancer, then now you have chances of developing that. Someone in your family had like a goiter, you find you're affected by the goiter and the likes. Yeah.
So you're also a surgeon?
Yes.
And you're talking about ENT.
Yes.
At what point do I need a surgeon? I mean, it's just my ear.
Yes.
Why do I need a surgeon?
So the full name is ENT, head and neck surgery. So our main goal is always just to operate. But then there are those conditions that we want to institute, like maximum medical therapy before we even think of surgery. Things like nasal conditions. Sometimes patients have allergic rhinitis, chronic sinusitis. Utasikia watu wanasema niko na sinuses. So we try to treat that medically first before we think of surgery. Patients who have like adenoids, we try and treat that medically. They're the drops that we give in the nose to use for like 3 weeks, 1 month, and we see how they're responding. If they respond well, we continue with the nasal drops. If they don't respond well, then now we have to proceed to surgery. Yeah, so we have a bit of medicine and a bit of surgery also. Yeah.
All right. So maybe before we get into the specific ear, nose, throat, generally, what are some of the symptoms that people overlook, yet there are serious symptoms of ENT conditions?
Yeah, so the commonest one is hearing loss. So someone might not even notice they have hearing loss. But then there are some things you might notice, like some cues, like you might find someone is always asking you, come again, or pardon, or they're watching TV and the volume is so high. You feel like the volume is high, but they feel like they're actually comfortably watching the TV. Ear discharge, some people disregard the discharge kabisa. Someone has pus coming out of the ear, they will go, weka mafuta ya kuku, then they think they're okay because the discharge will reduce kidogo. After 2 weeks, it will come again. They'll do the same thing, but the only thing they're doing is making it worse because they're only reducing the symptoms kabisa. I don't know how it works, but somehow it works for them.
I was just about to ask, how does it work?
We don't know how it works. It's not in our syllabus, so we're not taught about how to weka mafuta ya kuku, but it's a really big problem, and it's something we need to deal with. Things like nasal blockage. Unajua unaweza fikiria mtoto amefungana mapua, akona homa tu kila wakati, so just treating homa. But then you realize they actually have adenoid hypertrophy. They're suffering from tonsillitis. Someone tells you, no, don't worry, they will outgrow the tonsil. So the child is always suffering. The child is losing weight. They're not sleeping well at night. They're not growing well. They're not feeding well. They're not concentrating in class. So it affects your whole life. And you see these are things that people will ignore, then later on realize this was actually a problem. Then we also have kids who have like speech delays. They might also have an issue either with the brain or with their hearing, because you know for kids they have to hear first before they can speak. That's why we are encouraged to speak to your child. Hii mambo ya kuambia buju hapana. So you should actually,
it's not right?
Yeah, it's better when you speak to your child because then they're able to hear this is what you're saying. So I should be doing the same. So if they hear, then they can repeat and mimic and say what you're saying, so they develop the language and speech skills a bit better.
So wale wazazi wa abujubuju to the kids na wanakuangalia tu and they repeat the same thing. Alafu after some months unaanza complain mtoto wangu haongei. You see where the problem is, so improve on that. Now I know we'll be getting into some more questions zenye mtakuwa mmetuma, but I don't want us to go into the specifics. Generally, let's start with the ear, because the ear is such a big problem with many people. And they keep saying, hata sisikii vizuri, ni kwa sikio moja, si kwa zote. So let's start from, would you have an ear condition on one ear, and the other one is fully okay? Yeah,
it's quite possible. We've seen it happen many times. One ear might have been exposed, let's say, probably to an infection. Probably you traumatize the ear. Wale watu kuingiza kijiti ya kiberiti, kifuniko ya biro, you're feeling that nice feeling, earbuds, you're there scratching your ear. But then eventually you're just destroying your ear. So you can develop a condition in one ear. Probably one ear was exposed to like a very loud sound. So probably there was an explosion and it was coming from this side. So this ear was more affected compared to this one. So it's possible, yes, one ear can be affected independently. All right. And you've started with infections. So what causes these infections? Infections, like we've said, commonest cause is the upper respiratory tract infections. We have the bacteria, commonest Streptococcus pneumoniae, and it's the same one that causes pneumonia also. So it's quite common in our setup. And it's causing these infections. They're inadequately treated. By the time they're getting to us as surgeons, the condition is already chronic, because between 2 to 3 weeks, that's when we call it still an acute period. We can be able to treat it at that point, and probably it will resolve and your hearing might come back to normal. Or not? Because then with hearing, it's a delicate balance. Depends on how much of the infection has affected your ear, because your ear has a middle ear part and an inner ear part. So your middle ear transmits the sound to the inner ear, then the inner ear transmits it to the brain. So the infection can affect your middle ear and affect also your inner ear. So if it affects your inner ear, then also your hearing goes reducing. But of course, once it's affecting your middle ear, you have things like pus accumulating. So sound is not being transmitted well to the inner ear, and you find your hearing reduces. But if you're able to clear this pus infection, clear the middle ear infection, sometimes your hearing becomes normal again, and even the eardrum might heal. Because once you're having pus coming out of your ear, it means your eardrum has a perforation or a hole in the eardrum. So if we're able to treat the infection, sometimes the hole can heal on its own, but sometimes we have to do surgery to fix it. To heal it, So apart from surgery, is there any other way that you can maybe heal the infection? Because I've seen the other people who uses zile ear drops. So part of the treatment before surgery, we have to make sure that the infection is completely gone before we do surgery, because that also improves our chances of recovery, increases our chances of the surgery having a good outcome. So you'll find we'll do the eardrops for like 2 weeks, 3 weeks, 1 month. The infection goes down. In addition to other things that we do, we also do something called ear suctioning or cleaning. So we have to clean the ear, remove the debris, remove the pus, because if you try and put drops where there are pus, the drops won't really get to where they're supposed to get to, because the pus is blocking the ear. So we have to suck out the pus as much as possible, so that when you put in the drops, they go all the way to where the source of the infection is. And I've also heard of people who complain about wax accumulation. So let's start with, is it a problem? It becomes a problem when it's causing hearing loss. So people will come. They usually come complaining, Daktari, one of my ears is not hearing properly, or I wake up in the morning, my ears are blocked. Then when you look inside the ear, it's actually wax accumulation. Or they'll tell you, I'm trying to speak on my phone, I can't really hear quite well. Then we find it's wax accumulation. So what happens is probably people are using cotton buds in an inappropriate way. So you're using cotton buds, but you're actually pushing the wax back into the ear. So as much as victims. So as much as you're looking at the cotton bud and you can see, yes, there's wax on the cotton bud, there's some little wax you've pushed back into the ear. So what happens is your wax is produced near the eardrum. Then by various mechanisms, it's carried towards the outside. So that's the natural mechanism for how your ear cleans itself. So your ear, God designed it, it's supposed to clean itself. So the wax is produced near the eardrum, it's carried all the way to the outer ear, and you're able to wipe it. Just usually with your face towel, that's what we recommend. Your face towel on your finger, wipe just the outside of the ear, that's enough. Because your ear is supposed to have wax. The wax has a duty to trap dust, dirt, and such the likes. So as much as you think wax is dirty, you're supposed to remove it, ideally, it's serving its purpose.
Okay.
Yeah.
Oh, wow. And at what point do you know that it's now accumulating? Ni ukiacha kusikia, because I know that sometimes when you'd feel there's the wax.
Yes.
And instead of using the face towel,
Yeah.
you'd be tempted
Yes.
to use the earbuds.
Yeah.
So is there a proper way of using the earbuds? Ukifeel ni kama imeanza kukua nyingi and you need to clean?
Ideally, I would say if you feel like your ears are already blocked or your ear is full of something, ideally we would want you to come in, because sometimes the wax is so impacted. Because every time the wax is collecting dirt, dust and everything, it hardens. When it's produced, ni kama ile mafuta ya kupika. It's very liquidy, it's very light, it's moving inside the ear canal very nicely, collecting that. But once it traps dust and everything, it becomes harder. So it becomes harder, so the more you push it back in, you're just forming a cake. So by the time they come, the wax is so hard, even if we try remove it at that point, it's usually a bit painful for them. So we have to give medication to soften the wax first, over like a period of probably 3-5 days. Soften the wax first, and then now come in and remove the wax. So it might not really be easy to remove it at home once it's already impacted and it's formed that hard mass. So it's quite difficult to remove it. Then that one you'll have to visit an ENT specialist, either a surgeon or a clinical officer ENT, to be able to do that procedure that we remove it.
All right.
Yeah.
So for the people when you wanajifanyanga home treatments, so you feel it's like your ear is paining and you just go over the counter, get some ear drops and then you use. Is that harmful or?
It's quite harmful, because now you see if it's ear drops only work when, especially if there's an middle ear infection, if there's a hole in the eardrum, then the ear drops are able to go even through the hole and treat the infection that is in the middle ear cavity. Sometimes the pain is from the outer ear, so ear drops might work. So if you have conditions like otitis externa, so just inflammation of the outer part just before the eardrum. But if you have infections past the eardrum, before the eardrum perforates, then now even if you put drops, it's useless. And you'll find most people watakuja watasema tumeweka drops, nothing is happening, I still have pain. We look inside, there's no perforation, but the eardrum is very inflamed. So that means there's an active infection going in the middle ear. And in this case, we have to give antibiotics. And these are the antibiotics that usually have like extra strength, that are able to penetrate the from the blood and get into the middle ear cavity and actually treat the infection at that point. And these are antibiotics that we won't give for the normal 5 days. We give for 10 to probably 14 days.
All right.
Yeah.
And they're the ones you said when you use for only 5 days, then now it becomes a problem.
Yeah, it becomes a problem because you've only like treated the infection half of it. So there's still this half that will probably recur soon in like a week or two. Then you have the same problem again. Then you still go to the same chemist to give an antibiotics for 5 days again. So you're just making the condition worse. So by the time you're having an ear infection and such the likes, it's always best to just see an ENT specialist as soon as you can. There are quite a number in Kenya right now, so getting one might not be difficult.
Okay.
Yeah.
But now that you've mentioned that, how do you know a good ENT specialist? Because we've had people who are complaining. I'll give an example. One of us here, tataja ni nani? One of us here was complaining jana that he had an ear problem. The ear haikuwa inasikia vizuri nini, so he had to go to an ENT. So after ameenda kwa the ENT, alifanywa like it was a misdiagnosis. So he was given the wrong medication. After some time akapewa ear drops and it was really complicated. So how do you know a good ENT doctor?
Wow. Okay. Number one, at least for all ENT surgeons, we are registered by the medical board. You can easily go to the website, search the name of the doctor and find out if they're actually licensed and practiced to work as an ENT specialist. For the clinical officers, they also have the Clinical Officers Council where they're also registered on their website. As long as they've been paying their registration, their license fee every year, then they'll be maintained on the register. I would say if you're not satisfied with one, please seek a second opinion. Just go look for a second one and always start from the beginning. Tell them, I have had this issue. This is what I've done. I've seen this person who I thought was an ENT specialist or was an ENT specialist. They've done this, this, this. This is where we are. I don't feel like I have improved. Then what do we do from here? So then this ENT is able to contact probably the other ENT and find out, what did you think? What did you see about this case? Because this is what I'm seeing now. Because we usually encourage sharing of information between colleagues. Probably there's something you did and there's something I do differently. Then I'll tell you, let me try this and see if it works, then I'll get back to you. Because learning is always a continuous process, and we always encourage sharing of information. Yeah.
Perfecto.
Yeah.
Now, I know we've talked about the ear, but if you still have any question, we'll be looking at the questions a bit later. For now, let's talk about the nose health. And I know hapo kuna mambo mingi sana. So what are some of the common issues that, as you've been practicing as an ENT specialist, you found out that people are really suffering from?
So in the nose, we have a lot of trauma cases, number one. Someone was somewhere, probably riding in a matatu, amekaa ile kiti nyuma ya dereva pale, then an accident happened, then akagonga ile chuma iko pale mbele. So they usually have a lot of fractures around that area. Probably someone was playing rugby, basketball, akapigwa elbow, so they have fractures. The other commonest condition is epistaxis, nose bleeding. Quite common, affects children, affects adults, and especially in adults with history of hypertension. The hypertension just makes the epistaxis quite worse. Then we also have the issues of sinusitis. So that's basically inflammation in your sinuses. You basically have sinuses on your cheekbones here, between your eyes here. There are those that are anterior, there are those that are posterior. Then you also have sinuses upper kwa your forehead. So you find they can be affected differently. They can be clogged. Probably you had a cold, so the sinuses, the nasal mucosa is kind of inflamed, the sinuses are blocked. That's when you start feeling your nose is blocked, headache, you feel like your face is so heavy, you just want to lie down. So it gives you an indication that your sinuses are blocked. And if they're blocked and there's a bacterial infection, you start finding you have fevers, you have pus discharge from your nose. It can get worse. The infection can spread to your brain. You start having symptoms of meningitis and the likes. It can spread to your eye. So you have swelling of your eyelids, or your eye is actually pushed out depending on where the pus is located. Then of course you also have inflammatory conditions of the nose, I would call. Polyps, quite common. They cause blockage of the nose, and these ones will cause blockage for like years or months on end. You've tried nasal sprays, you've used antihistamines, you've tried everything, your nose is just not unblocking. But when you look inside, you see something that looks pale, whitish sometimes, sometimes pinkish, so it's blocking your nose. Then there are those who have tumors in the nose. So these are more of cancerous conditions. So they'll have more of nasal blockage, yes, long-standing. Then they'll also probably have nose bleeding in addition. And quite commonly, we also find they have a swelling in the neck. So that's where now the neck comes in. So we have to treat the nose plus consider the neck also.
And now that you've explained all the conditions za the nose, na tumesikia ni nyingi sana. Do we have like common practices that people can make sure they are practicing to make sure that they're taking good care of their nose?
Just like the ears, the nose cleans itself. It's usually a moist environment. Mucus is produced. It flows to the back. There are things called cilia that carry the mucus and any dust. That's why we don't have dust just accumulating here. So it's carried to the back and you usually swallow it and you never realize it. So the nose is also cleaning itself. So for the nose, you're good to go. The other thing is we need to avoid practices like picking our nose. Sometimes you're picking your nose. Actually, the commonest way you get a cold or a flu transmitted is if probably you shake someone's hand, then you touch your eye or you touch your nose or you touch your mouth. So that's when now the viruses get into your body. Okay, they might have sneezed in your face, so that's okay, like direct. But if you shake someone's hand, then you touch your eye, you're just rubbing your eye. Throughout the day, we usually find ourselves either you touch your eye, you'll touch your lips, you'll touch your mouth, something will happen. So you end up transmitting the virus.
Now, talking about that, there's the other part of nose bleeding. Because umesema ku transmit virus, and that reminds me, hata before tuende kwa nose bleeding, that is where tulikuwa tunaambiwa that you need to make sure that you're cleaning your hands, wash your hands regularly. Make sure that you're cleaning your hands. Make sure that you don't touch your face.
Yes.
Very important. Sawa sawa. But now there's the nose bleeding part.
Yeah.
There are people who just, kukiwa na joto sana, wana nose bleed. Kukiwa na
Yes.
baridi sana, they nose bleed.
Yes.
So what condition is that?
Yeah, so it's just basically the same nose bleeding as any other nose bleeding, but now, iya joto sana, it's because now, like I said, the nasal mucosa is supposed to be soft. So the lining of your nose, it's soft and it's also moist. So if it's too hot outside, you find it dries up and it's like it forms crusts.
Okay.
So inakauka. So ikikauka, it cracks up and then you have small blood vessels running in your nose, especially hapa mbele.
Okay.
So those blood vessels, once these crusts form and they crack up, they end up opening the blood vessels, then you have nose bleeding. Now, those ones who experience nose bleeding when it's especially cold, probably they also have a condition like allergic rhinitis, so they have allergies to cold, to dust also, probably strong perfumes and the like.
Yeah.
And they find themselves scratching or rubbing their noses, especially when they're feeling like the allergic reaction is coming on. So you'll find they're always rubbing their nose. And that rubbing motion is also like trauma to these blood vessels, which opens them up, and then you start experiencing nose bleeding.
Oh,
Yeah.
okay. Wow. All right. Now, before we go to the next, because we're supposed to look at the throat,
Okay.
now that you've mentioned about nose bleeding, we have some mythbusters.
Yes.
Myths that people relate to the
Okay.
ENT.
Yes.
Yeah. So we'll be looking at them, and then you'll be telling us the right practices to do.
Okay.
Yes.
Right.
So we can get the mythbusters exactly. So the first one here, you say that the nose bleeding can be stopped by tilting your head backwards.
That's very false. Actually, the other one that's usually there is people want to put a damp cloth on the forehead.
That's not-
Ati kitambaa baridi unaekelea kwa forehead.
It doesn't work.
It never works. The best way to
wow.
handle a nosebleed, especially if it's an anterior nosebleed, because we have two types of nosebleeds. So we have the anterior nosebleed and we have the posterior nosebleed.
Okay.
So the anterior one, ndo hii hapa, you are picking your nose, bleeding starts, especially for kids,
Yeah.
adults also. Or let's say it was so dry, then it crusted, then bleeding started. It's usually from hapa mbele.
Okay.
So if you can just hold the front part of your nose, pinch for 10 to 15 minutes, bila kuachilia. So you're just seated comfortably, you're leaning forward, pinch 10 to 15 minutes, breathe through your mouth, you should be good to go.
Okay.
If it doesn't stop, then now you have to come to hospital, because then it might be a posterior bleeding, especially for patients who have hypertension, the elderly patients. We want to be more erring on the cautious side, so we might have to look at them in hospital. That one we have to do something called posterior packing.
Okay.
That one you can't do from home.
Wow, okay.
Yeah.
Because we've seen most of the people, I love that you've actually made that clear. Most of the people wakiwa nosebleed tu hivi kidogo, they look for something damp waka hivi.
Yes.
Yeah. And is there a danger of maybe tilting back when you have a nosebleed?
The only thing is you'll probably end up swallowing the blood, which might cause you a bit of nausea,
Yeah.
and you might vomit later, but no real danger is posed, unless it's very severe and it ends up going into your airway, blocks up your lungs or something, but
Generally,
it's not really.
Okay.
But we don't advise you to lean back, always just lean forward and pinch.
okay, perfect.
Yeah.
Second mythbuster,
Yeah.
it was about whispering, that whispering is safe when you have a throat infection. Hapo tunakuja kwanza. Let's talk about hearing loss, then we'll come to the other one. That hearing loss is always as a result
Of
aging.
Very false. There was a point, one of my colleagues was doing a study while we were still doing our Master of Medicine in ENT, and we actually found some of the older guys had better hearing than the younger people. So their hearing was kind of preserved somehow. Probably they were not exposed to loud music. They're not riding in matatus every day, which has loud music and everything. They're not exposed to the horns and the loud noises in town, construction everywhere. They're not exposed to loud music. They're not using earphones all the time.
Yep.
They're not setting the
young
volume
people.
very high.
Yeah.
Yes. So their hearing was actually quite better than the younger guys.
Okay.
And there were guys who were younger but also still had like very good hearing. So it's not an age factor, but aging, yes, can cause your hearing to reduce.
Yeah.
But it's not always that you're old and your hearing has reduced because you're old. Could have been an infection.
Yeah.
Could have been something you're born with. Could have been there's family history of someone who was deaf, so your hearing also went down. Could be your ears are blocked by wax.
Okay.
Yeah.
Okay.
Yeah.
Oh, wow. So it's not about age, it's
Yeah.
about the practices that we do, especially
Yeah.
in us young people.
Especially
very
those
loud
ones.
music
Yes.
and all that.
Yes.
Now let's go to throat, which has been a real problem right now. As we started by saying, sai kuna kahoma,
Yes.
and everyone and I feel there's something, most of the people rather, want to
Yeah.
feel there's something going on with their throats. So what are some of the throat conditions that you've encountered as an ENT specialist?
So we see a lot of reflux. Watu wanasemanga niko na ulcers, we see a lot of that. So it causes a change in your voice. You find someone, tunasemanga sauti inabadilika, they had a normal voice, inabadilika inakuwa kama ile ya pasta.
Oh, hold on. So you mean the people who, when you're not gonna, let's call them heartburns.
Okay.
Yeah. So your
Yes.
reflux,
Yes.
the reflux, some of the heartburns.
Yeah.
With time, it might change your voice.
It can, because now you see what happens is you have your esophagus where food moves down to your stomach, and where it meets your stomach there's a valve. The valve is usually very tight, but for some reason or the other it might become loose. So especially when you're lying down, let's say after supper, umekula supper, immediately umeenda kulala, which is common practice because we are working the whole day.
Yep.
You get home late, 9 p.m., you just want to eat and sleep.
Yeah.
Understandable, but when you go to sleep immediately after feeding, probably your stomach is still too full, the valve is loose, so you find whatever is in your stomach, the acid and the contents might reflux, so they come back up because you're lying down flat, so there's
Yeah.
a chance that it might come back up, and when it comes back up it might irritate your throat area because you have your voice box mbele and your esophagus iko nyuma, so they are in very close relationship.
Okay.
So whatever comes from the esophagus can come and irritate the voice box. Now the voice box area is not used to acidic environment. It's not used to seeing food and things that have been chewed up and gastric juices and hydrochloric acid. So what happens is you develop nodules there. Nodules or swellings because of the inflammatory reaction. This area is usually covered by mucus, so you find now this acid has come, it's disrupted the environment, so your body tells you, hey, something is wrong, something is happening. So you find you develop those swellings on the vocal cords especially, and the vocal cords usually move, they touch each other and separate as you're speaking.
Okay.
So when you develop swellings around the area of the vocal cords, they're not able to touch perfectly. It leaves some spaces, those spaces where air escapes through, and you find your voice reduces or your voice begins to change. So you find you have more of a hoarse voice. You are usually in a soprano voice, but then now your voice is very scratchy and hoarse.
Oh, okay.
Yeah.
Kuna watu tumeanza kuwa worried tutaenda hospitalini tukitoka hapa. Now, apart from that, what are the other
throat conditions?
throat conditions.
Yeah, so we have that one because of reflux. Very common. People are so stressed out.
Yep.
Economy, everything. People are so stressed out. They're having ulcers, acidity, reflux happening every day, plus also their diet. Kuna wale wanakula pilipili sana, food iko na spices mob. For some people, sukuma wiki, beans, majani ya chai, coffee, alcohol, cigarette smoking again. It's always implicated in like everything.
Okay.
Then there are those who develop something called vocal cord nodules. Yeah. So you sing in the choir on Sunday. On Monday, sauti haiko. Yes. So that's because of the nodule. So same thing happens. Because you're singing, you're straining your voice, so your vocal cords are vibrating very hard. Because as trauma, swellings happen, your voice goes down so that you can relax kidogo, pumzisha sauti, then the swelling resolves, then your voice is back probably by Tuesday, Wednesday, then Sunday again.
Okay.
Then
but is the practice dangerous?
We usually,
is there a long term?
So not everyone develops the vocal cord nodules.
Yeah.
We've seen musicians who developed the nodules, probably they had to undergo surgery because depends on the size also.
Okay.
Because there's always the conservative management part. Remember we said ENT has the medicine part and the surgery part. So we'll do the conservative part. We might send you to a speech therapist. They teach you about voice hygiene. So how to use your voice properly.
Okay.
So probably you're struggling to sing in a soprano and that's not your
voice,
your strength. So we might tell you to probably switch to another tone ya kutumia ukiimba kwa choir. So you can still sing, yes, but at this tone. And then of course there is the The other conditions, we have malignancies also. So there are patients because of alcohol, cigarette smoking, they develop malignancies, laryngeal cancer. Quite common in our setup. Mostly affects men, and they're usually older, but we've seen one case, one of the patients we operated on, he was actually quite young, he was 36 years. So it's starting to affect even the younger guys. And I think could be anything, smoking, alcohol, guys are also vaping so much, guys are using shisha so much. So things are changing now. There are viral infections, people are having infections by human papilloma virus. They're also developing such the likes. We also see conditions in kids where you have something called respiratory papillomas. So respiratory papillomas happen because probably the mother had an infection in the genital tract. Then as the kid was being born, the kid inhaled some of the virus, so the virus is there dormant on the vocal cord area in the voice box. But then at around 1 year, 2 years, the child starts having a hoarse voice, and you're wondering what's happening. Then they develop difficulty in breathing. Then when we look inside, we find there's so much papilloma, so swellings that are there. There are so many, and they actually block the airway, so they're struggling to breathe and the likes. Then there are other conditions where children can be born with also. So you find instead of your airway being this big, it's a bit smaller. We call it laryngomalacia or tracheomalacia. So it's smaller than usual. So you might find these children have like a noisy breathing. They're not breathing so well. They're struggling even to breastfeed and the likes. So it depends on the severity. It can be really bad, can be mild. The other throat conditions, I think those are the mainly ones that we see.
How about throat infections?
Infections, most of the time they are treated. Like they just go to the chemist, they'll treat the infection, it will go away. Tonsillitis, quite common. They'll go to the chemist, watapewa antibiotics, something to gargle, painkiller, they'll be okay.
All right. Perfect. So let's talk about the hoarseness of the voice.
Yes.
Because that's also something that most people are going through. So how severe can it be? Are there people who just have a hoarse voice naturally? Or how are you supposed to know that now that I have a hoarse voice, I'm supposed to go get checked?
So number one, we always say not all wheezing is asthma. So some people might have that hoarse voice and noisy breathing, and someone might misdiagnose you as having asthma. But then they are treating asthma, it's not improving. You should now get a second opinion. Have someone, because in ENT what we do, we want to look inside the throat and see what's happening. So we'll spray your throat area so that you're not having that gag reflex. Then we'll look inside with a camera, see how do the vocal cords look, is there edema, is there swelling, how are the vocal cords moving, is there anything blocking your airway that's causing the hoarseness of the voice? So sometimes we look inside and there's nothing completely. Probably we'll just rule it out as their normal voice. It might not really be hoarse, but it might be like a bit variated from the normal population. Then of course, other causes of hoarseness of voice, definitely we have to check for the papillomas, check for the nodules, check for signs and symptoms of the reflux. We'll also check for anything that might be suspicious, like a swelling, blocking the airway, preventing the vocal cords from moving nicely and touching each other nicely. That would cause a change in your voice.
Perfect. Now let's look at the other myth buster. And then sasa tuangalie, is it true or is it not true? The second one, that whispering is safe when you're having a sore throat. So when you're having a sore throat, ukiwhisper, wache kustrain voice yako, with time itakuwa uko sawa.
Now, it's kind of like a, how do I call it? You might think it's safer to whisper, but in real essence, it's like you're causing yourself a more of, what do we call it? It's like you're causing more harm. So you'd think since I will whisper, it means I'm preserving my voice. Naongea kwa sauti ndogo. I'm preserving my voice will heal faster. But actually experts have seen if you whisper, it's just as worse as someone who is shouting. So you're still straining your voice because you're whispering and it's already affected, so you're whispering, so you're straining it more. So just try and speak with that voice that you have currently, or probably look for another means of communication, probably write stuff down. So it's just the resting that's usually better, or just speaking that normal voice, and also probably reduce the amount of times that you need to speak, because that might also help relieve the condition, in addition to the medication that you're probably taking.
Perfecto.
Leo katika makala yetu ya health tips tutakuwa tukiangazia thorn melon. Thorn melon is a tropical fruit which grows on warm areas. It's rich in vitamins, dietary fiber, antioxidants and anti-inflammatory properties. Thorn melon is mainly consumed during the hot season. Some of the healthy benefits of consuming thorn melon includes the following. 1. Rich in antioxidants. Thorn melon is rich in antioxidants which helps the body to build and repair blood vessels and nerve cells. Thorn melon also helps to neutralize free radicals. 2. Good for digestion. Thorn melon is rich in antioxidants, minerals and soluble fiber. This helps to smooth the colon while allowing healthy bowel movements. 3. Good for vision. Thorn melons are rich in vitamin A, C, E, beta-carotene, polyphenols, flavonoids and phytochemicals which prevents macular degeneration. 4. Maintains healthy bones. Thorn melons are rich in zinc, calcium, selenium and vitamin K. This helps to keep the non-healthy and maintaining bone density. 5. Anti-cancer. Thorn melons have minerals which helps to combat free radicals, inflammation and tumors. Ni hayo tu kwa sasa katika makala yetu ya health tips. Tupatane Jumatano ijayo. Jina langu ni Perpetual Nyambura.
Now, we were answering this question. Akukuwa amesema ni nani? Let me see. Yes, Mary. And Oliza, is it true that sore throats can cause heart problems?
Yeah, so we were saying probably what she means is patients who are suffering chronic recurrent tonsillitis, can they also have heart conditions? And you find, yes, there are those patients who've had chronic recurrent tonsillitis. The same bacteria that causes the tonsillitis is the same one that goes and affects the heart valves. So you find you develop something called rheumatic heart disease. The same can also go and affect your kidneys, and you have glomerulonephritis. So yes, it can affect your heart and it can affect your kidneys. If it goes untreated for so long, or you're having frequent recurrent infections, then you can develop such.
So you need to get checked.
Yeah.
All right. Anasema Anita Caro, I got a condition with my throat, feeling like I have inflammation on the inside center of my neck. Mostly I got severe headaches. In fact, at times I feel like my blood pressure is running so fast. I have no pain in swallowing food or saliva, but I have a big discomfort when I work or strain. At times my voice changes and hearing so the voice and the hearing changes. What could be the problem?
Probably they're suffering from reflux. We'll definitely need to look into the throat.
Okay.
Then for the hearing, we need to check the hearing also to be sure what's happening, because usually throat conditions don't cause hearing problems. Yeah, so we have to look at that. Yeah.
Hello to you too. I'm feeling like my throat is full of mucus. What might be the cause?
Probably
Koda hoba. You'll be well. Takwa sawa. Anasema hello. My question is, mbona watu hupata tonsils? My mom huvimba mostly akitake vitu warm. What is the issue and how can it be solved?
Tonsillitis, most of the patients, we see them having issues, especially when they take cold things or things that have lots of sugar. With warm things, I haven't seen, but probably she needs to come in, we have a look.
Okay.
It might be something different.
All right. We had another question here. Alikuwa anauliza, what are some of the chronic allergies that are related to ENT?
Yeah, so most of our patients will have allergies to cold, allergies to dust, allergies to strong scents like colognes, perfume and the likes. Allergies to smell of smoke, to cover hizo. So those are the common ones that we see.
Perfecto. Now, we'll wind up on that, but if you have any more question in regards to ENT, you can always ask. Hopefully, we'll have another session, a Q&A session. Yeah? Yeah, a Q&A session where you get to ask all the questions and we get to answer. So what would be your parting shots?
I would say we need to take the ENT conditions more seriously.
Yeah.
Things like kuweka mafuta ya kuku to treat such things as ear conditions, we need to cancel that.
Yeah.
Myths about tonsillitis causing loss of taste and such the likes, we need to be wary of such. Please visit an ENT specialist, have all your questions answered, ask all the questions that you need to ask, and then have a candid discussion with your ENT specialist. Make sure you're comfortable with the answers once you leave their office.
Yeah.
If you're not comfortable, go to a second one, seek a second opinion, but always, if you find your condition is not improving, affecting any of the ENT areas, please visit an ENT specialist. It might be something more serious, but you're downplaying it. By the time you come, it's too late, and there's very little that we can do. Yeah.
To even show the seriousness of it, you've said that the issues of throat can actually affect your heart. Yeah, so you have to be very careful. Kama una feel kuna shida yoyote, just go get checked. It's very important. You'd rather uambiwe hii ni homa tu. You can just take some meds and you'll be okay. Rather than uambiwe now this is a bit too serious, ungekuja mapema. So as Doc said, go get checked. If you feel you have any symptoms, it's better ukienda mapema. Sawa? So for anyone who would want to maybe ask a question or come get treated, watakupata wapi?
You can always find us at Nakuru PGH. We're always there, Block 7, every Tuesday from around 8 a.m. to around midday.
Okay.
And if they would prefer to see me privately, they can find us at CK Patel building, 3rd floor, room 3B.
Okay.
They can always call to make an appointment. You can reach us on 0114 600 796.
Perfect.
114 600 796.
Okay.
Yeah.
I know that you'll be having the contacts on the screen very soon. So if you need to maybe call, make an appointment, or no consultation, jikuje mwenyewe, enda pale. It's easier when you're there.
Yeah, better.
Yes.
Yes.
So visit. You said CK Patel.
CK Patel building, 3rd floor, room 3B.
Okay, room 3B.
Yeah.
Perfect. Thank you so much for coming. You've
Welcome.
had an amazing time. We've learnt a lot. Personally, have learnt a lot.
Yes.
And I know that we've answered also most of the questions that you've had. For the questions that you haven't answered yet, I know that you're going to be having another session where we are going to answer. Now, that is it. Thank you so much for tuning in. God bless you. I know that you've learned something. We do value your time highly. This is what we've talked about. Kama ulifika late kidogo, and maybe you weren't able to listen in from the introduction of the discussion that we had. We said that some ENT conditions can be genetically transmitted, e.g. hearing loss. Yes, kuna conditions kama hearing loss that inaweza kuwa transmitted genetically. That means if your mom ama your grandmother or your grandfather alikuwa nayo, there's a possibility ya kwamba utakuwa na hearing loss. So if you realize kuna anything fishy about your hearing, make sure you go get checked. If you realize unashinda ukiuliza watu pardon, go get checked. That is a sign. Sawa. Also, we say that seeking treatment early prevents serious infections. Yes, we said like throat infection can actually cause heart problems. So you need to go get checked. Mapema ndio best. Sawa. And then avoid using earbuds to clean your ears as it naturally cleans itself. In fact, tukasema earbuds wa inasukuma wax uko ndani. So you can always just use your bathing towel as you're taking a bath. Una clean tu pole because the ears naturally they clean themselves. Also the nose, they also clean itself. Ndio maana tumeambiwa kuna hizo the hairs kwa mapua, na that's how you have the mucus. It's for that reason. Sawa. And avoid picking your nose as it can lead to entry of bacteria and also nose bleeding. All right? Again, smoking and alcohol consumption, yes, leads to throat infection. And not only that, smoking and taking alcohol, even without the infections, it is wrong. Why are you taking? It is very wrong. Sawa. And it can also lead to throat infections And we've said that throat infections can also lead to heart problems. So do you want heart problems because of smoking and taking alcohol? Wachana nayo, all right? We've said good hygiene helps in preventing infections. Kwa hivyo, stay clean, don't touch your nose and your eyes and your mouth. So make sure you're clean, wash your hands. It's very important. Na ya mwisho, and which is very important, if symptoms persist, seek further medical advice. Na ukienda, ufeel hajakusaidia ama you've not gotten the help that you needed, go to another ENT specialist. Wako wengi Nakuru, wako wengi Kenya, so make sure you seek a second opinion. Sawa sawa? So that is it. We've had an amazing discussion on the ENT, and that is the ear, nose, and the throat. And we've been here with Dr. Oywer. Yep, and we've gotten a lot. So as I have promised, we're going to be having a Q&A session where we will all be able to answer or to ask the questions, and then the doctor will be able to answer the questions. And now that being said and done, we're getting to Did You Know? We're having a segment ambayo tutakuwa tunakuletea something that you didn't know. So we're here to ask, did you know that there are more stars in the space than there are grains of sands on every beach in the world? Yani, ukieka the grains of sand in every beach in this world, bado haitoshi ukikompare na the stars zenye ziko in space. Unaona vile unaangalianga jua alafu unaona kama stars ni kidogo iko tu pale. Stars ni nyingi sana. And you compare them with the grains of sand. Na grains of sand ni ile ukishika hivi sand, like ile sand moja. You see the way you can't count them? So stars ni nyingi kuliko grains of sand in every beach in this world. Hivyo ndo tuko na stars nyingi. And you remember Abraham. Yes, ni Abraham, right? Alipromisiwa that utakuwa na watoto wengi kuliko the stars. Imagine such a beautiful promise from God. That is to tell you that you should serve God and serve Him diligently, because those are some of the promises you get. Imagine having many kids like the stars. And the stars, tumesema, ni nyingi kuliko the grains of sand zenye ziko kwa beach. How beautiful. For now, let's get today's inspiration so that we can get to know how we are being inspired today. So, ndani ya today's inspiration, yale inasema, the secret of your future is hidden in your daily routine. Yep, it's true. That the secret of your future is hidden in your daily routine. So today what you do is what determines your future. Kama leo hakuna kitu yenye unafanya ya maana, then it means that your future haitakuwa ya maana, because it is in every day that you get to build your future. Vile unaona mtu yuko leo, it's as a result of what he or she has been doing. Haijakuja tu pap. It's because we've seen there are people when you are blow up na wanajulikana and things are going well in a day. There are people when you will say they are just blessings of God, and you see wote tunajua that God can just decide to bless you, but also because of your heart and all that. But how watu ukiangalia wamekuwa wakibuild up on their career. They've been building up on their families. Wamekuwa wakibuild capacity. So what you're doing on a daily routine will determine your future. Sawa sawa. So make sure that every day you're working towards what your goal or where you want to go. It's an everyday thing. Sio ya siku moja unaomba Mungu leo nataka sijui kufanya nini. Atakwambia you need to build up. You need to build capacity. All right? So that is today's inspiration. We are being inspired to make sure that we are doing the best today for the sake of tomorrow. Sawa sawa. So that has been it. Thank you so much for tuning in. This has been Afya Clinic. Tumekuwa na clinic ya kiafya, yeah, because we need to look at our health, and we'll be doing this every Wednesday. Okay? So, we'll do a challenge. Tumeambiwa you need to take a lot of water so that your throat, inasaidia pia with your throat to make sure that you're not dehydrated and everything is going well with your body. So we do a challenge. Okay, so from this Wednesday to the next Wednesday, just make sure that you take enough water. Inakwanga 8 glasses per day. So if you're able to do that, next week, tuambie. Ujipe tu challenge ya kutoka leo Wednesday mpaka the next Afya Clinic that we'll be having next Wednesday, so that you make each and every day a day where you take 8 glasses of water and you'll see a change in your body. Hata mimi najaribu, I am really trying. I've been trying to work on it. So let's all make it a challenge. Tukikuja hapa next week, tutambiana ni nani ndio ameweza kuifanya. And if you actually do it and do it successfully, utuambie, have you felt like there's a change in your body? Because there must be a change in your body. Others, thank you so much for tuning in. God bless you. God be with you. My name is Kahugo. And now may the grace of our Lord Jesus Christ and the love of God and the fellowship of the Holy Spirit be with us now and forevermore. Amen and amen.